Okay. Good afternoon, everyone, and thank you for being here. We've heard some important announcements.
This conference is being recorded.
Excellent. We've heard some important announcements today from the Prime Minister, the Minister of Finance, and the Governor of Bank of Canada. Before turning to my colleagues for an update on where we are in the coronavirus, let me talk a little bit about the agreement that the Prime Minister reached this morning with the President of the United States. La frontière canado-américaine est le symbole de la relation sans égale qui entretiennent nos pays et nos populations. Tous les jours, les échanges commerciaux de 2,7 milliards de dollars traversent la frontière. Et ces échanges sont essentiels pour l'économie et le bien-être des Canadiens et des Américains. En réponse à la pandémie de COVID-19 qui nous touche actuellement, le Canada et les États-Unis ont convenu de restreindre temporairement tout passage non essentiel de la frontière canado-américaine. Les voyageurs ne seront plus autorisés à traverser la frontière à des fins récréatives ou touristiques. Dans nos deux pays, nous encourageons les gens à rester chez eux. Cette mesure collaborative et réciproque s'inscrit dans cette approche prudente. Les passages frontaliers essentiels se poursuivront. Les gouvernements du Canada et des États-Unis sont conscients de la nécessité de maintenir les chaînes d'approvisionnement entre les deux pays. Ces chaînes d'approvisionnement permettent d'acheminer les aliments, le carburant et les médicaments indispensables aux gens des deux côtés de la frontière. Les chaînes d'approvisionnement et notamment le camionnage ne seront pas touchés
will not be affected by this new measure.
Des Canadiens et des Américains
Canadians
traversent
and Americans
également
are
la
both
frontière tous les jours pour
borders
accomplir
every
les
day
travaux essentiels
to carry
ou
out
pour autres
essential
raisons
work or
urgentes
for
et
other
essentielles.
urgent and essential
Cela ne
reasons.
changera pas.
And that will not
Ainsi,
change.
le Canada et les
Thus,
États-Unis restreindront
both Canada
temporairement
and the United
tout
States
passage
will
non essentiel
restrict
de la
non-essential
frontière
travel across
canado-américaine.
the Canada-U.S.
Let me
border.
repeat this in English. The Canada-U.S. border represents a unique relationship between our countries and our people. $2.7 billion in trade crosses the border every day, and that trade is essential to the economies and well-being of both Canadians and Americans. In response to the ongoing COVID-19 global pandemic, Canada and the United States are temporarily restricting all non-essential travel across the Canada-U.S. border. Travelers will no longer be permitted to cross the border for recreation or tourism. In both of our countries, we are encouraging people to stay home. This collaborative and reciprocal measure is an extension of that prudent approach. Essential travel will continue unimpeded. The Canadian and U.S. governments recognize that it is critical for us to preserve supply chains between our two countries. These supply chains ensure that food, fuel, and life-saving medicines reach people on both sides of the border. Supply chains, including trucking, will not be affected by this new measure. Canadians and Americans also cross the border every day to do essential work or for other urgent or essential reasons. That will not be affected either. Therefore, Canada and the United States will temporarily restrict all non-essential travel across the Canada-U.S. border. Now, let me just add that this agreement was concluded this morning in a phone call between the Prime Minister and the President. I spoke twice yesterday with Vice President Mike Pence and this morning with Secretary Pompeo. Minister Blair has been speaking often with his U.S. counterpart, Secretary Wolf, the Secretary of Homeland Security, and he will speak further about that. This morning, I also held a phone call with all of the premiers of the provinces and territories. We spoke about this and many other issues. Later today, my colleague Jean-Yves Duclos and I will be having a conversation with the leaders of the opposition. Let me just conclude by saying that we all now know that the advice of our experts is that this situation will get worse before it gets better. What is also true is that as a country, we are rising to the challenge. Individually, collectively. We can do this. Let's take care of ourselves and each other. Everyone who can stay home should stay home. The decisions that each one of us takes today will save lives. So now let me turn to, we will hear this morning from the Minister of Public Safety and Emergency Preparedness, Bill Blair. Then we will hear from our inspirational Minister of Health, Patty Hajdu, and from our Chief Public Health Officer, Dr. Tam, and from our Deputy Chief Public Health Officer, Dr. New. Après ça, on va écouter le leader du gouvernement à la Chambre des communes et le lieutenant du Québec, Pablo
Quebec Lieutenant Pablo Rodriguez.
Bill, please.
Well, thank you very much, Chrystia, and good afternoon, everyone. As the Deputy Prime Minister has said, this is a very important day for Canadians and in our relationship with our American neighbors. The longest undefended border in the world is a border that we share, and both of our countries acknowledge and recognize how our economies are integrated and how important it is that we work so collaboratively together in maintaining the integrity of that border, but also in maintaining the essential trade activity that takes place between our two countries. It is essential not just for us, but for our American allies, and its importance is recognized in the agreement we have made together today. It's an acknowledgement that that trade is essential and needs to continue in these very difficult and trying times. And so while I think the announcement is quite clearly focused, as the Prime Minister announced earlier today, that we have agreed to temporarily restrict all non-essential travel across the Canada-U.S. border, it's equally important to acknowledge that what we have also achieved is we have secured those vital economic supply lines that will be absolutely essential not only in maintaining the health and safety of Canadians throughout this crisis, but also assist greatly in the economic recovery that must surely follow. Let me explain a little bit about what this actually will mean to travelers. It means that travelers will no longer be permitted to cross the border between Canada and the United States for things like recreation and tourism. But essential travel will continue unimpeded. We recognize, as I've said, the critical importance of maintaining supply lines between our countries. But it's also important to recognize that Canadians and Americans cross this border every day to do essential work and for other urgent or essential reasons, and these will not be impacted. We know, for example, there are many border cities where citizens on one side of the border travel each day across that border to work in our hospitals and to provide other essential services. And we have to make sure that those people can get to work, to do the job of keeping Canadians safe, because their work will be important to save lives. We also know that others are impacted, and for example, international students, workers with visas, temporary foreign workers, their work is important to maintaining our country and what they contribute. And so they'll be allowed to enter Canada as well after observing the 14-day period of self-isolation. Other measures have been and will continue to be targeted and effective while ensuring the protection of Canadians' health and safety, which is our first and greatest priority. In both of our countries, we are encouraging people to stay home, not to engage in unnecessary and non-essential travel. And we believe that today's announcement is a crucial step in our efforts to keep Canadians safe. I think it'd be difficult to imagine two countries that are more closely linked and allied through economic integration and friendship than Canada and the United States. We share geography, history, culture, and trade. Our people are linked by our shared values and by our economies. And every day, as Chrystia has mentioned, Canada and the U.S. do over $2.7 billion in cross-border trade. Our businesses and our way of life depend on the free flow of these goods and services and by the important work of essential workers. And that's why we believe this announcement and what has been achieved in a mutually agreed upon reciprocal agreement with the United States to impose reciprocal measures that will be effective in keeping both of our communities safe. It's about our health and safety and also about our eventual recovery. The entire world is dealing with COVID-19, and Canada and the United States are no exception. But we are working collaboratively together to face this challenge head on, and we have, as with all of our significant global challenges, we do it best when we work together. Thank you very much.
Okay, thank you very much, Phil. Now we'll hear from Patty, please.
Hello, everyone. Bonjour à tous. The aid package and the agreement with our American neighbor announced earlier today are both very important steps to support the health and safety and wellness of all Canadians. So today I want to talk a little bit about another aspect of that, and that's Canada's testing capacity. We've been working around the clock with provinces and territories to make sure everyone has what they need to continue to detect and interrupt the chain of transmission. And provinces and territories have been ramping up their capacity to do so in incredibly innovative ways. I want to thank them for how quickly they're moving. However, the current situation is constantly evolving, and that's why today we also approved 2 new diagnostic tests, which will enable provincial labs to test even more quickly. As Dr. Tam has said, early diagnosis is a critical component of slowing down the spread of the illness, and Canadians can be encouraged that Canada has been leading in terms of our testing capacity at, I think, 44,000 tests to date. Dr. Tam has the most current numbers. The efforts that we're seeing from Canadians across the country to slow the spread of virus is truly phenomenal, and I know that the changes that we're seeing are overwhelming. Changing our behaviors is not easy, but Canadians all across the country are showing that it's possible. From the small changes like washing our hands more frequently to the large ones like working from home and self-isolating when possible, these actions are all helping our neighbors and our friends and colleagues very much. Merci beaucoup aussi encore pour tous les travailleurs qui donnent leur service dans cette temps d'activité. Nos actions maintenant grandes et petites sont très importantes pour nos familles et nos communautés. Merci.
Families and communities. Thank you.
Merci et bonjour à tous. Globally, there are over 200,000 cases of COVID-19 in over 165 countries. As of right now, there are 598 cases of COVID-19 and 8 deaths in Canada. What is most concerning is that over the past week, we've started to see a sharp rise in cases, and a number of provinces have reported cases with no links to travel. This is a signal that there is some degree of community spread, so our time to act is now. To find and stamp out community transmission, public health authorities across Canada remain laser focused on detecting and interrupting any chains of transmission. To date, we have now tested over 50,000 people for COVID-19. En plus des mesures de santé publique qui ont été prises, les gouvernements, les groupes communautaires, les organisateurs d'événements et les autres entreprises se sont mobilisés pour aplatir la courbe épidémique. C'est maintenant à notre tour d'agir. Les Canadiens ont intégré le concept de la distanciation sociale, qui consiste à s'éloigner des autres physiquement. Partout au pays, les gens trouvent différentes façons de maintenir cette distance de 2 mètres. Entre autres, ils restent à la maison, au lieu d'aller au travail ou à l'école. Mais désolé, pas de fête ou de nuit passée chez des amis.
Parties or sleepovers.
Ils évitent les rassemblements publics et les endroits très fréquentés. Ils ne prennent pas les transports publics ou évitent l'heure de pointe.
Where possible.
Ils prennent des dispositions pour faire déposer les provisions comme des produits alimentaires à leur porte. et non pas de visiteurs chez eux.
Separating from others in
Ils
your
utilisent
home,
la technologie pour communiquer
or
avec
rather not
leurs
having
amis et leurs
visitors to
familles.
your home, and
Et
using online technology to
et
communicate.
s'ils sont aînés ou
And if
ils ont
you are
des
an older
problèmes de
adult
santé,
or have a
ils
medical
maintiennent
condition,
l'espace de protection
keeping
nécessaire.
that protective space.
Mais vous pouvez
But by all
absolument
means,
aller pour
do
promener
go out for a
dehors,
walk in the
faire
fresh
des
air,
épiceries,
as long as you
pourvu
keep
que vous
to the
respectiez la
2-meter
règle de
rule.
2 mètres. Et
And be
assurez-vous
sure
que
to
vous lavez
wash
les
your
mains
hands
dès que
as
vous
soon
revenez
as you go
à
back
l'intérieur.
inside.
In addition to public health actions, government, community groups, event organizers, businesses have all banded together to flatten this epidemic curve. Now it is up to the rest of us, and Canadians are embracing the concept of social distancing, which is all about separating yourself from others physically. All across the country, people are looking at different ways to maintain that 2-meter distance by staying home from work and school, but sorry, no parties or sleepovers, avoiding public gatherings in crowded spaces, avoiding public transport or go off-peak hours, arranging to have supplies such as groceries dropped off, not having visitors to your home. Use technology to connect with families and friends. And if you are an older adult or have a medical condition, keeping that protective space is very important. But please, by all means, go out for a walk in the fresh air. Go to the grocery store, as long as you keep to that 2-meter rule, and be sure to wash your hands as soon as you get inside. There will be many inconveniences in our lives in the coming weeks, but it is an opportunity to get creative. Like Canadians who created the caremongering trend and isolate for love trend, we can do our part in curbing an epidemic while being supportive of each other. So this is our chance right here, right now. Merci.
Thank you.
Merci beaucoup. Thank you very much, Dr. Tam, for that very clear and useful advice. Dr. Gnou, est-ce que vous avez quelque chose à ajouter?
Dr. New, do you have anything
Dr.
to
Tam a
add?
parlé avec nous en français aujourd'hui.
Exactement. J'ai
We'd like to
pas
hear you
quelque
speak in
chose
French.
d'autre à dire parce que
Well,
Dr. Tam a bien exprimé dans
don't
les
have
deux
anything
langues
else today
officielles. Nous
because
sommes tous
Dr.
prêts à
Tam
répondre aux questions dans les deux langues
spoke in both
officielles.
official languages, so
Beaucoup.
we're fine. Thank you very
Pablo,
much.
please.
Pablo, please go ahead.
Yesterday, I had a first conversation with opposition House leaders. We talked about the next steps to recall the House of Commons to bring in emergency economic measures in response to the COVID-19 pandemic. This morning, we had a conference call with the House leaders, with whips from different parties, where we started to discuss the logistics around how this will work. And I want to state very clearly that there is great collaboration amongst all parties. We are working together to respond to this very serious challenge, and we will continue our discussions in this manner. Tous les partis se sont entendus sur la nécessité de rappeler la Chambre et je les remercie de leur collaboration. Tout le monde fait ce qu'il peut pour que ça avance rapidement et je m'attends à ce que ça se concrétise la semaine prochaine. Je suis très heureux que tous les partis étaient capables de travailler ensemble la semaine dernière. En fait, ça s'est fait de façon exemplaire. On a fait adopter les lois nécessaires pour que le gouvernement puisse continuer à verser l'argent pour faire face à la pandémie. C'était une étape importante ce qu'on a fait la semaine dernière, mais il y a encore plus à faire. De nouvelles lois sont nécessaires pour aider l'ensemble des Canadiens. It is critically important that we pass these measures quickly in order to provide support to Canadians in need. And I will continue to engage with the opposition in an open, transparent, and collaborative manner. And together we will bring back the House of Commons in a responsible way and work on legislation that will help Canadians through this difficult time. Now, how will this work? The government will write a letter to the Speaker of the House of Commons. It will indicate that in the public interest of the House of Commons be recalled in order to bring in emergency economic measures to help Canadians, to help all Canadians. If the Speaker accepts the request, the House then could be recalled 48 hours later. While the details have not been decided yet, my sense is that it could happen next week. We're working in that direction. Alors, la Chambre, on le sait, a besoin
As we
de
know,
20
the
députés,
House
incluant le président, pour qu'elle
requires
puisse
a
siéger, pour
quorum
qu'elle
of
ait
20
quorum.
members
Et je vais
to
continuer à
sit,
discuter avec les
and I will
partis
continue
d'opposition
to
sur le
discuss
nombre
with
de
the
députés
opposition
présents,
parties as to the number
un
of
nombre qui
members who will be
respecte
present,
la
a
proportion de
number
la
that
Chambre,
respects
donc
the
ce soit un
proportion of the parties
miroir
in the House,
de la Chambre.
so that it reflects the
Last
composition of
week,
the House.
we all saw how quickly the House and the Senate can react to the extraordinary situations by working together in the best interest of Canadians, and the government intends to continue to be open, transparent, and share as much information as possible with all MPs, with all senators. Et ce que l'on fait, il faut prendre conscience de ce qu'on fait, c'est sans précédent, c'est historique en fait. Et je veux être clair, nous sommes tous unis dans cette crise, on va y faire face ensemble, on va la traverser ensemble. And I want to be clear that we're all united in this crisis, we will face it together, and we will get through it together. Merci beaucoup. Thank you.
Okay. Merci Pablo. Et
Thank you, Pablo.
évidemment, les
And
ministres Duclos
obviously,
et Garneau
Ministers Duclos
sont
and Garneau
également
are
avec
also
nous,
available,
et je sais
or
qu'ils
rather are
seront
also with us.
ravis
And I know
d'aussi
that
répondre à vos
they
questions.
will be delighted to answer any of your
Merci à
questions.
tous. Thank you, everyone. We'll now go
Thank
to
you.
questions.
We will now go to
Tivia.
questions.
À moins que je l'ai raté, là, puisque vous en avez
Ms. Freeland,
plusieurs à en avoir
unless I
parlé
missed something,
aujourd'hui,
a number
on
of
ne
you
sait toujours
have
pas à
spoken today,
quel
but we
moment
still
la
don't know
frontière sera
when
fermée aux
the
voyageurs.
border will actually be
La
closed to
frontière
travelers.
américaine.
I'm talking
Pouvez-vous
about
être
the
plus clair
Canada-U.S.
là-dessus cet
border.
après-midi?
Can you be clear on that this afternoon?
Je peux répondre à la question.
Answer. Yes, I can answer your question.
Comme vous savez, comme le Premier ministre
As you
a
know,
expliqué,
as the Prime Minister has explained,
pour nous, c'était très
for
important
us, it
d'avoir
was
une
very
réponse
important
coordonnée
to
et
have a
réciproque
coordinated
avec les
and
États-Unis.
reciprocal
Nous
response
sommes des
along with the
voisins et
United
des
States.
partenaires.
We are neighbors and partners.
Concernant les détails,
As concerns the
incluant
details,
la question de
including
le moment
the
quand
matter
les
of
nouvelles
when
mesures
the
seront
new
en
measures
pratique, en
will
vigueur,
be
on est en
implemented,
train maintenant
we
de
are
confirmer.
currently confirming
en
that
étroite collaboration
in very
avec
close
nos voisins.
collaboration
Mais je
with
peux
our
dire
neighbors to the south.
maintenant
But I can tell you
que
right now
ce n'est pas
that
le moment
it is
pour
not
faire
the
des
time
voyages
to
touristiques, les voyages qui ne sont pas
travel
essentiels.
for
Et on a
non-essential
pris déjà
purposes,
la
for
décision,
tourism or
le président
recreation.
américain
And we
a
have already made the decision
ouvertement
with
parlé de
the
la
U.S.
décision
President.
qui
We have spoken
était
about this
prise. Le
decision,
Premier
and
ministre
so
a
has
parlé
President
de ça
Trump.
aussi. Concernant
Concerning
le précis moment d'entrée
the
en
exact
vigueur,
moment
on est en train
as to
maintenant
when
de
this
coordonner
ban
les
will come
détails
into place.
exacts
We're
parce qu'on
coordinating
doit
the exact
travailler
details
avec
right now
beaucoup de gens
because we
qui
have to work
travaillent
with a
chaque
great number
jour
of people
à la
who are
frontière. Et
working
je veux
every day
aussi
on the border.
dire aux Canadiens,
And I would
aux
also like
journalistes,
to
que
say Canadians,
nous
to
sommes
Canadians
dans une
that
période
we are
exceptionnelle.
in an
Et
extraordinary
dans une période
times.
exceptionnelle,
And
c'est
in these
nécessaire
extraordinary
de
times,
prendre les
it is
décisions très
important
vite.
to
C'est
make
ce qu'on a
decisions
fait
very
aujourd'hui et
swiftly.
cette semaine.
That's what we
Quand
have done
on
today
prend
and
les
this week.
décisions très très vite,
When we
nous
make
pensons
these
que c'est
decisions
important
very
d'être
swiftly, we think it
honnête
is
et ouvert
important
avec
to
les
be
Canadiens,
honest and open with
d'annoncer le
Canadians,
moment que la
to
décision
announce
est prise,
when the
qu'on a
decision
pris
is
la
made,
décision,
that the
et d'être
decision has
prête
been
à être
made,
ouverte et
and to
dire
be
tous les
ready and
détails
open
ne
and
sont
to
pas
say
absolument
all the details have not yet been
confirmés,
nailed
mais on
down
va le faire
to
dans les
the
heures
last one,
en
but
avance.
that it will be done in the hours to come.
I'll just repeat that in English. So in terms of the actual moment of entry into force, let me be clear. The decision has been taken, and this is a decision to restrict entry at the Canadian-U.S. border of both Canadians and Americans traveling across the border for discretionary, non-essential purposes. For example, tourism and recreation. That travel will not be permitted. The question was, what is the precise moment when these instructions will be enforced at the border? And the answer is we are still working very energetically with our American colleagues to determine the precise moment when that will be enforced by the hardworking people at the border. But let me be clear. A decision has been taken. It's been announced by our Prime Minister and by the U.S. President. And I would also like to be clear to anyone thinking of making a tourist or recreational trip across the Canadian-U.S. border, please don't do it. It's not good for you. It's not good for your neighbors. And I do also want to say, and I think that Patty has been very good at explaining this to Canadians, we are working right now in an exceptional time. I think we all understand that. And what that means is, as political leaders, we need to operate a little bit differently. We need to be in a position to take decisions very quickly, and we need to be honest and open with Canadians about those decisions. So a clear decision has been taken. Each one of the practical details has not yet been agreed. But even as we are sitting here, that practical work is being done, and the details will be announced as soon as they're confirmed.
Par souci d'honnêteté, puis c'est pas ma sous-question, là. Est-ce qu'on parle de jours ou de
you're
semaines?
talking about being honest. Are you talking about days
Pour la
or
précision,
weeks?
de jours,
For the
de
decision?
heures
a
ou de
number
jours.
of days, a
Monsieur
number of hours or
Rodriguez,
days.
si la Chambre est rappelée la semaine
Minister
prochaine,
Rodriguez, if the
est-ce
House
que
is
ça veut
recalled
pas
next week,
dire que les
doesn't
chèques
that
vont
mean
arriver bout
that checks will be
à dire?
Non, en
inaudible
fait,
for the
on
interpreter?
procède le plus rapidement
Answer.
possible.
We are proceeding as
Moi,
quickly as
je
possible.
me réjouis de l'appui de l'ensemble
very
des
happy
partis
that
de l'opposition. On s'est
all
tous
the opposition
entendus
parties
pour appeler la
have,
Chambre le plus rapidement possible
supported
et
the
de
government.
procéder
We
rapidement.
worked
Il y a
well
certains
together and they
mécanismes
agreed
qui sont
to
nécessaires pour
recall the
mettre en
House very
place.
quickly. There are
Ça
a
nous
few
prend le
mechanisms
projet
to
de
put
loi
in place.
complet qui
It's
doit
going
être
to take,
envoyé au
the
président
full
de la
bill that will
Chambre
have to
et
be
une fois
sent
qu'on
to the
envoie le
Speaker of
projet
the
au président,
House.
48 heures après, on peut se
And
voir.
48 hours after that, the House can be recalled. Thank you.
I'm just going to ask Bill if he may have a point to add to your first question.
If I may, and I don't have a great deal to add, except I will assure you our officials are moving very rapidly to action the decision that was made today. And we do expect in very short order, it is reciprocal that those measures will be put in place. But I'd also like to make the point, I would very much urge Canadians and Americans to respect the principle behind the decision that was made and avoid non-essential travel.
We'll go to CBC.
Dr. Tam, you're in constant contact with your provincial counterparts on a daily basis. How many ventilators does Canada have and test kits? And how many do you estimate that we need?
Well, right now, the federal, provincial, territorial table on looking at logistics is very much meeting every single day. Certainly, we are actually preempting any need for ventilators by purchasing some already from the federal level, even though there hasn't been any specific request necessarily for some of them. So we're trying to just preempt any need. In terms of the other supplies, for example, we've secured 800,000 swabs just for test kits, for example. As I've said, Canada's already tested 50,000 people. 800,000 swabs go some ways, but it doesn't mean we can stop. We just have to keep getting more, on an ongoing basis. So this is not a sort of a static reality. But the reality is that there is global challenges in securing certain supplies and certain types of personal protective equipment. What I do know is that of the personal protective equipment that is needed by Canada, we can currently expect to meet those needs about at least 75% of the requested amount. But we're pulling all stops to look at any other suppliers, bulk purchasing, and any other means. So, but I don't want to say that in Canada, we shouldn't be taking really good care of our supplies. We mustn't waste things. We've got to be really careful in the hospitals and how you actually use those supplies. And so we're working really hard also to provide guidance to people on the sort of stewardship aspect.
And I think Patty has something to add.
I'll just add to that. Obviously, we're working through Health Canada, Public Health Agency of Canada, and with the Minister of Procurement and her team to put in large orders, because we know that even though the provinces and territories have indicated what they think they might need, in fact, we may need more. And I think Dr. Tam has been clear and quite direct in saying that we are not the only country looking for these kinds of supplies. So we are also working with the Minister of Innovation, Science, Economic Development, think that's still his title, Minister Baines, to make sure that we have a capacity within Canada to in some cases help factories and other manufacturers who maybe are not able to make the things that they sell right now, but can rapidly retool to make the things that we're going to need. So that work is happening right now. And the reason we can't give you exact numbers is because it is in a fluctuation period. As provinces are drawing down materials from our national stockpile, of course, we're trying to seek to replace those and, in fact, increase the amount that we need over and above what we may eventually use. I think this is the prudent measure to ensure that we can have what we need, ensure that we even perhaps buy more than what we need. But I will also say that manufacturers globally are trying to make sure that countries aren't stockpiling in a way that will actually prevent the ability of other countries to get what they need. So this is a global effort that is happening on procurement and on trying to coordinate what countries will need when they are seeing the sort of epidemic or the spike, if you will, of their particular curve hit. It's really important to remember that actually those global communities, those countries that don't have access to those kinds of supplies matter just as much, even though it might not seem so when you're in the middle of a crisis. Because in fact, if we can't actually think ahead to what countries that are going to be hit next will need, then if their infections increase, then that continues that wave of virus from circling the globe. And what we're trying to do is accelerate our supplies from an immediate urgent need, accelerate our work on the treatment for COVID-19, and accelerate our work on a vaccine. Because until we actually get all of those three things working together, we could actually see a scenario where we would have the virus continue to circle the globe. And that's the true challenge here. So we're working very closely, as Dr. Tam has said, with our provincial territorial partners, but also our international partners to make sure that what we procure today, we have a capacity to, first of all, use, and then possibly share down the line if we end up having more than what we need. And all of that evolves in real time. That's why it's so hard to give you precision around numbers.
And I just want to underscore one thing that Patty has said, which is very important work being led by Minister Baines and Minister Anand, and which was discussed today by the premiers in their call with me, and is actually really inspiring, which is Canadian manufacturers are putting up their hands and are stepping up and are looking at whether they have the capacity to retool and to produce here at home the things that we need. And that has really been just an example for me of Canada coming together, Canada being united. They are being extremely creative. They are working with the provinces. They are working with us. We'll have more to tell you as these ideas and these efforts actually come to bear fruit. But it is a real example of a Team Canada approach. And I am very grateful to all the manufacturers who've been in touch with us, who have been in touch with their provincial leaders to say, you know what, I think I can make this stuff for our country.
Border restrictions. President Trump said, quote, "It's not pertaining at this moment to trade between the two countries." Could border measures affect trade, and what could be the consequences?
So it's a great question. And a reason why we took the time that we needed to work this through carefully and cooperatively with our American neighbors was because we understand how essential that trading relationship is, and our American neighbors understand how essential that relationship is as well. So you heard from the president, you heard from the prime minister. We are absolutely clear that these border restrictions will in no way impede the trading relationship. They will in no way impede the essential trade happening between Canada and the United States every day. We understand on both sides of the border, the last thing the Canadian or U.S. economies need right now is another blow. So this is really about saying discretionary travel shouldn't happen. If your trip is not essential, if it's for tourism or recreation, just don't take it. And there is tremendous clarity on both sides that trade needs to continue, and essential workers need to continue to cross the border to do their jobs. And I want to really underscore one other thing, which is, this is a time when all countries in the world, as we heard from Dr. Tam. This is a global pandemic. Every country is really struggling with tremendous challenges at home. And in that struggle, I think that it is a very positive thing that Canada and the United States have managed to handle our border in this very collaborative and reciprocal way. And it says something about the partnership that we have here in North America. I don't know if Bill would like to add anything there. Do you have anything to add?
I will also simply, Chair, I'm having very regular conversations with my provincial counterparts. All of them have stressed the importance of maintaining those supply chains and economic activity that crosses back and forth between our borders. And they cite very specific examples. That observation really informed our discussion with our counterparts in the United States, who also recognized its importance. It's important today. It's important every day. The food that goes on our shelves, the pharmaceuticals that we will require, are all part of that international trade between our two countries. But it's also essential to maintain those supplies to facilitate the economic recovery that will come. Many of our businesses and are suffering or going to suffer in the very difficult circumstances that we face in the near future. But it's also important to maintain the economic conditions that will give rise to our recovery. And that was also very much a part of our discussion with our American colleagues and with our provincial partners across the country.
Le devoir.
Monsieur Duclos, ma question est pour vous. Beaucoup des annonces qui sont faites aujourd'hui concernent l'assurance-emploi ou en fait des programmes parallèles. Dans un contexte où vous avez beaucoup de fonctionnaires qui travaillent de la maison, qui sont peut-être pris par leurs enfants qui ne sont pas à l'école, n'ont peut-être pas de réseau sécurisé. Quelle confiance avez-vous de pouvoir traiter un si grand nombre de demandes dans le contexte?
Merci. Et effectivement, le message aujourd'hui, c'est qu'on n'oublie personne avec les mesures historiques qu'on met en place pour aider tous les travailleurs, les familles et les entreprises. C'est un ensemble de mesures qui est historique. Il n'y a personne qui n'est laissé pour compte dans les mesures que M. Morneau a annoncées, que ce soit des gens admissibles ou non à l'assurance-emploi, que ce soit des gens qui ont besoin d'être à la maison pour prendre soin d'eux-mêmes, pour prendre soin de leurs proches, que ce soit des enfants qui n'ont pas d'école, que ce soit des parents qui ont besoin d'aide, ou que ce soit pour des raisons de perte d'emploi. Tous ces gens, tous ces travailleurs, toutes ces familles sont appuyées, et en particulier les plus vulnérables. J'ajouterais aussi, avant de passer à votre question, que quand on parle de vulnérables, on parle aussi de très vulnérables. Et que certaines des mesures qu'on a annoncées aujourd'hui, et vous allez le constater en regardant les informations, apportent un appui considérable à certaines familles qui en arrachent présentement et qui vont en arracher encore plus dans les prochaines semaines. Laissez-moi donner l'exemple d'une maman monoparentale avec 2 enfants à la maison qui se retrouve à la maison parce qu'elle a besoin de prendre soin de ses enfants qui sont pas à l'école ou parce qu'elle a perdu son travail. Mais cette personne, déjà, recevrait à peu près 1 000 $ par mois en allocation canadienne pour enfants et va recevoir, avec les mesures annoncées ce matin, un autre 1 500 $. Et en plus, elle va être protégée. Parce que si elle perd du revenu, parce qu'elle ne peut pas être au travail, qu'elle a perdu son travail, qu'elle soit admissible ou non à l'assurance-emploi, elle va recevoir autour de 450 $ par semaine au cours des 15 prochaines semaines. Donc, c'est une mesure qui est là pour dire à tout le monde, on ne vous oublie pas. Maintenant, évidemment, pour que tout ce travail se fasse correctement, ça prend la contribution substantielle de la fonction publique et on a confiance dans la capacité de la fonction publique de faire ce travail dans des circonstances absolument extraordinaires parce qu'on sait que les fonctionnaires de la fonction publique non seulement vivent aussi ces difficultés, mais sont conscients de leur rôle majeur dans ce qui s'en vient. Donc, les services informatiques s'ajustent évidemment à la demande. Les consignes sont claires. La priorité, c'est de prendre soin de soi-même et de ses proches, de profiter au maximum des opportunités de télétravail, sauf dans des circonstances exceptionnelles où la sécurité ou l'intégrité du fonctionnement du gouvernement serait mise en cause.
On pense vraiment pouvoir verser l'argent en 2 ou 3 semaines. On sait que déjà, quand on place une demande pour l'assurance maladie, l'assurance congé de maladie, ça peut parfois prendre des mois, il y a des longs retards, et là, on a moins d'employés pour le faire. Quel geste posez-vous pour vraiment vous assurer que ça va aller vite?
2 choses. En gros, il y en a plusieurs autres. La première, c'est le fait que des modifications, des améliorations qui devaient être faites prochainement au système d'assurance-emploi, par par exemple, ne seront pas faites aussi rapidement que prévu. On va concentrer nos efforts sur ceux et celles qui ont besoin de notre aide immédiate. Et la deuxième chose, c'est que certaines des mesures que l'on a annoncées aujourd'hui, je parle donc, par exemple, de la bonification du crédit pour la TPS, je parle de cette allocation de soutien et de soins d'urgence, il y a deux allocations différentes. Ces deux allocations vont être mises en place par l'Agence de revenus du Canada, qui a la capacité d'agir plus rapidement et beaucoup plus efficacement que Service Canada. On ne se le cachera pas, Service Canada a déjà parfois de la difficulté à traiter les demandes rapidement. Donc, on va éviter un engorgement encore plus important pour le travail que Service Canada va devoir faire au cours des prochaines semaines et allouer une partie de ses responsabilités vers l'Agence de revenus du Canada.
Thank you. We'll now go over the phone. Opératrice, on va prendre les questions au téléphone.
Merci. Thank you. Please press star one at this time if you have a question. Veuillez appuyer sur l'étoile 1 si vous avez une question. Our first question is from Mary Kay Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Hi there. My first question is for Minister Freeland, and then my follow-up will be for Minister Hajdu. The first question is what President Trump said this morning. He said, at this moment, trade will continue. Can you please respond to that?
Sure. Let me be, really clear and really reassuring. This has been a very positive, very collaborative conversation with our American neighbors. There was absolute agreement from the first sentence that was uttered that it is essential for Canada and the United States to continue to maintain the very important trade between our two countries. There was not even an atom, a molecule of pushback on that. It's what we said from the outset, and it is what our American partners said from the outset. We also heard in the context of these conversations, for example, in my conversation with Vice President Pence yesterday, the real importance that he places on NAFTA, how delighted he is that Canada was able to ratify it. Was it just on Friday, Pablo? I mentioned it to him, and he said, you didn't need to mention it to me, Chrystia. We noticed it right away. It's very important to us. It's a very important vote of confidence in the North American economy at this difficult time. So I would really see this agreement as a true vote of confidence by Canada and the United States in the importance of maintaining that essential trade at a very difficult time. And I also see it as an example of how we are able, at a really, really difficult time, to be good neighbors to each other. One of the things, I don't think Vice President Pence will mind if I say that, he said to me yesterday, look, the president is saying to everyone, it's time to stay put. We hear your prime minister saying to Canadians, now's the time to stay at home. And so we really see this as an extension of those very correct policies in both of our countries, where we're saying to people, now's the time to stay home. Now is the time to practice social distancing. And an extension of that, we just heard Dr. Tam actually advise us, now is not the time to go visiting your neighbors. And that includes now is not the time to go visit your American neighbors, or for our American neighbors, now is not the time for them to come and visit us. Ça va.
Non, je veux vraiment souligner que c'était une très bonne, très positive conversation. Les conversations que j'ai eues avec le vice-président Pence et le secrétaire Pompeo, les conversations que Bill a eues avec le secrétaire Wolf, plusieurs conversations que le premier ministre a eues avec le président Trump. On a vraiment une étroite collaboration efficace. Tous les deux pays, nous comprenons sans un argument. On a eu des arguments avec les Américains, mais concernant cet enjeu, c'était une discussion sans argument.
there are no arguments. We understand each other. We all understand the importance of trade between our countries. And it is more important now than ever because, as Minister Molyneux explained this morning, and as the Prime Minister explained as well, these are tough times economically speaking as well. So for us, by making this decision, by announcing this decision, we want to do two things. On the one hand, to continue our policy of social distancing, that's very important, and at the same time, to reassure both Canadians and Americans that we understand the importance of trade between the two countries and that trade will continue. Thank you.
And I think the second part, Bill, do you have anything to add? And then the second part was for Patty.
Yeah, I think there was a follow-up question from the Globe and Mail over the phone.
I have a follow-up question, for Minister Hajdu. My question is about essential workers who are terrified and contacting us, wondering if it's safe for them to still be operating in the trucking industry, for them to still be in construction sites, for them to still be in public works. What's your message to them? You're telling everybody to stay home, and yet you're also telling them to stay on the front line.
Mm-hmm. Well, I'll start, and then I'll actually turn to Dr. Tam, because I think the clarity around who needs to socially isolate and what that looks like is going to be different depending on the context of each person. First of all, I have to thank all of those workers that are on the front line, that are serving in a variety of different ways, in essential ways, that keep our groceries stocked, our pharmacies running, our lights on, if you will, and the goods moving back and forth. We know that we owe you all a debt of gratitude. But I will also say that there are precautions that people can take when they're working to make sure that they themselves are not contracting the virus or unwittingly spreading it to other people. And I will say Dr. Tam said something yesterday that was really important, and I think a way for all of us people that are healthy to think about this. It is obviously we're all worried about catching the virus, but if you act like you already have it, and that you're protecting the person next to you from getting it, is a very useful way to think about it. Because the majority of us still, remember, will exhibit mild to medium symptoms. Most of us will not die of getting COVID-19. But what we're trying to do with social distancing is protecting the people in our lives from getting it. And so we can take precautions in our everyday life that we've repeated over and over. I will repeat them again just for good measure. We should wash our hands. We should definitely stay 2 meters away from one another in public spaces. We should stagger our working hours if we have the capacity to do that. We should for sure stay home when we're sick and let our employers know that we are unable to work when we're sick. That was part of the package today, was to make sure that everybody can do that, regardless of their own personal benefits or insurance situations. And ultimately, at the end of the day, these measures will make sure that we protect those people that are counting on us. So I'll turn to Dr. Tam to speak a little bit more specifically about frontline workers and things they can do.
Well, there's a lot that every workplace can do to look at how to do this social distancing without really impacting the critical work that they do. So, I'm most familiar, for example, with the healthcare sector. Of course, the healthcare sector is very, very important. So you cannot just keep all healthcare workers at home. This is not possible. You actually need them working. So you institute specific things like screening at the front door of the hospital, so that making sure that sick healthcare workers don't go to work, that they have the ability to remove themselves as soon as they have signs of any illness, for example, which is why, obviously there are broad messages for the public, but every workplace, every essential service have the ability to think through how you do social distancing and still maintain your business continuity and the incredible job that everybody is doing. I do think that, in some cases, people can do telework, but in other cases, in construction, for example, no, you can't. But you might be in an open kind of space. You might be able to maintain a certain distance from others and absolutely wash your hands. But as the Minister of Health said, that the most important thing really, really is to not go to work when you're sick. This is not something that people intuitive at doing in North America, quite frankly. We just sort of just keep going and going and going, and that's not how you want to behave at this time. And, you know, if you are doing some incredibly important things like maintaining grocery stores open, everybody needs food. You know, ways to practice hygienic measures, have alcohol, hand sanitizers at the ready. Definitely wash your hands when you go home. But it is some of those very basic personal hygienic measures that you can use at work to maintain your health and not spread to others. But maybe you're working with older people. Well, there you need to take special precautions to protect them, long-term care facilities, but other people who come in contact with others. So I think that there's so many different ways, and I do think companies are actually really stepping up and looking at all sorts of innovative ways that people can do things. Doctors actually doing more telemedicine. So you don't stop your general practice or family practice, you just do it in a different way.
We'll go to the next question over the phone.
Thank you. Our following question is from Justin Ling, Freeland. Please go ahead.
Hi there. Question is for the Deputy Prime Minister. I'm wondering if you're satisfied with the way in which the government has communicated to the country during this crisis. Obviously, press conferences have been late. In some cases, details about the travel advisories, travel bans have taken hours to get out to the public. And really, the government of Canada is not releasing a significant amount of data about the new transmissions. It's leaving that to the provinces. I'm wondering if you think changes need to be made going forward to sort of communicate more effectively with the media and the public.
Look, as the Prime Minister always reminds us in cabinet meetings, better is always possible. And I fully embrace and accept that. And I also really understand the absolute paramount importance of effective communication during this time. This is a time when, first of all, things are changing and developing very, very fast. And this is a time when people are understandably anxious. And so people are absolutely right to be demanding of our government that we communicate often and that we communicate effectively. The fact that we are here now every day is part of our commitment to doing that. When it comes to communication that you're hearing at the federal level and at the provincial level, look, Canada is not a highly centralized country, quite the contrary. And I really would like to salute and embrace and encourage the way in which provincial leaders, the premiers, are doing a fantastic job and are being leaders in their provinces. That is something we support 100%. I had a very good call with the premiers this morning, and I said that to them directly. They are the frontline healthcare providers, and I think each one of them is doing a terrific job of taking that leadership. And the federal government will never want to get in their way. We want to support and encourage them, and that is what we're seeking to do. At the same time, it's very important, because this is a global pandemic, it's very important for the provinces to understand and for Canadians to understand that we are not going to be quibbling about federal-provincial jurisdiction, that the federal government understands that we need to play a leadership role, and that's what we're doing, including very much in healthcare. And that was one of the reasons for having the call with the premiers this morning, was to hear directly from them. And I said to them, let's be sure we are communicating with each other. Tell me what you need, and we will be here to provide it. And I know Patty does that with the provincial ministers very, very regularly. I would also like to salute the leadership which we are seeing from the mayors. I did a call yesterday with the big city mayors, and we are seeing a lot of mayors, all the mayors really, stepping up and doing what their municipalities need. That is a really good thing as well. One other thing I do want to say is all of us as Canadians need to get used to a situation in which things are changing and moving much more rapidly than we are accustomed to. This is a global pandemic, and the consequence of the very important measures we are taking to limit the spread of that pandemic in Canada mean that there is serious collateral economic impact, which the Prime Minister and the Finance Minister addressed today. Dr. Tam shared with us yesterday an inspirational quote from an Irish doctor that she works with through the WHO, who has said to us all, choose speed over perfection. And that is a great motto. That is our motto. So what you're going to see from our government is an absolute acknowledgement. We are not perfect. What we can promise you is that we are going to act with the alacrity and the agility that this situation demands. It is going to sometimes mean that we make announcements to you of decisions that have been taken, important decisions that we think Canadians need to know about, without being able to fill in all the details in the moment we make that announcement. That is the open and honest and effective way to operate and communicate in this situation. That's what we're going to do. Now, I see Patty wants to add something. Please.
The Deputy Prime Minister and I are becoming extremely intuitive about each other through this process. I'll just agree largely with the Deputy Prime Minister, and I will also say that since the beginning of the outbreak, as you know, we've been talking daily. Obviously, the situation evolves daily, and sometimes what we thought we knew about this brand new virus with a whole bunch of new research and a whole bunch of new science that evolves every day is not what we find out the next day, or there is new evidence, or there are new approaches to try. And so much like the Deputy Prime Minister has said, we have been obviously working very hard to make sure that we are responding to each new area and crisis that this virus presents itself. Someone I am very close to the other day told me a bit of an analogy, and maybe I'll tell it to you. He said to me, it's like an earthquake went off in Wuhan all those months ago. And I looked back the other day about when I first talked to the press corps about the COVID outbreak. It was at the cabinet retreat in January, mid-January. At that time, we didn't really know what we were dealing with. We knew we had a new disease. We knew we didn't have an antidote. We knew we didn't have a virus. And we didn't really know what extent it would pose to the world health situation. And so we've been talking every day since then. And of course, so much has changed. I smiled a bit when one of my colleagues said, I think it was Deputy Prime Minister said to Paulo, was that just on Friday? Because every day is feeling like it's a week. And I think it's that way for Canadians too, as they're watching the news. We're going to be here with Canadians every step of the way. And we're going to take those hard decisions together. And we're going to figure out these really big challenges together, because no portfolio is unaffected. That big tsunami that got unleashed actually happens, and we've been watching it happen around the world, trying to prepare ourselves as a country, and it affects things that we can't even anticipate it will affect in some ways. We've done a ton of scenario planning, but of course, each portfolio has a number of things that are implicated as you get to another stage of this particular situation we find ourselves in. So I want to thank Canadians for being so supportive. I know there are lots of worries and lots of concerns and lots of back and forths, but I want also Canadians to know that we are obviously taking this extremely seriously, as you can see by the announcements day after day. And I want to thank the press corps as well, because you have been trying to keep up with a rapidly changing situation and providing Canadians information that's as accurate as it can be, as timely as it can be, especially given the volume of information that's coming at you. And I know that you're working round the clock just as we are. And I think the service that you're providing to Canadians is exemplary. And I think the fact that so many of your outlets are making your news stories available free without a paywall is critically important, because we're all going to be able to do our things more effectively and to protect ourselves and our families more effectively if we have information that is evolving as rapidly as the changes. Thank you.
And just as a follow-up, I wonder if you can tell me whether or not there actually is good data communication from the federal government to the provinces. After the SARS outbreak, a report basically found there was no good centralized data collection that we could share with other countries or provinces or cities or health authorities. And just really quickly for the House Leader, I'm wondering if you can tell me if there's any consideration of having Parliament meet digitally over teleconferencing. Obviously, it kind of flies in the face of the government's request for people to stay home if you're recalling MPs and senators back from across the country.
Okay, that was actually 2 follow-up questions, Justin. We noticed. So did your colleagues who are here. And I think Dr. Tam will take the first, and then Pablo obviously will take the second.
Yes, so I work with all the Chief Medical Officers of Health, and they've been extremely collaborative. Information is sent to us at the national level. Obviously, some of it is very detailed at the local level. That's not the kind of data that you send at the national level. At the national level, we maintain privacy and we get very critical data elements, and that is absolutely happening. But you also have to remember that some of the public health investigations take a bit of time. So when you find a case and you want to look at contacts and you find out more about those contacts and you investigate them, it's not that that is an instantaneous thing. I can tell you that Chief Medical Officers actually was picking up the phone every time they found a new case to me, even in the middle of the night. That's how fast things work. Lab testing. We know when a lab test becomes positive, even if we didn't actually know anything about the patient that was actually linked to the positive test. And so that's been happening really in real time. So do we need more detailed data in order to look at more in-depth research? Yes. I mean, again, that's through research funding. That's not necessarily surveillance or case reporting. There's a lot of those elements which is done through actual research studies, and those are also ongoing as well. So all I could say is that we've had incredible collaboration.
Okay, Pablo.
Yes, well, to answer very directly, a teleconference for seating of Parliament is not possible, definitely not now, maybe one day. But there are different ways to call back Parliament. The one we're looking at is with a minimal number of MPs. We know that the quorum is 20, including the Speaker. We could go to 25 or 30. We are actually, as we speak, the whips are discussing the different scenarios. So let's say we bring back 25 MPs that reflect the proportion of the House. It's a mirror of the House, and we take MPs that don't have to travel by plane.
Thank you. We'll go to the last question over the phone.
Thank you. A following question is from Mélanie Marquis de La Presse. La prochaine question est de Mélanie Marquis de La Presse. À vous la parole, please go ahead.
La Presse.
Oui, bonjour à tous. Si je peux me permettre par commencer avec une demande spéciale, c'est d'essayer d'arriver à l'heure pour les conférences de presse, parce que comme plusieurs journalistes travaillent de la maison, mais ça bloque, ça monopolise des lignes téléphoniques en vous attendant. Alors merci, s'il vous plaît, de vous ajuster là-dessus. Ma question, la première, c'est pour Mme Freeland concernant la frontière, la fermeture de la frontière. Monsieur Trump parlait d'une période de 30 jours. Pouvez-vous confirmer? Puis juste aussi préciser par rapport aux les snowbirds qui rentrent. Je comprends que les Canadiens sont invités à se placer en quarantaine, mais disons qu'un snowbird arrive à la frontière terrestre avec des symptômes de la COVID-19. Où sera-t-il mis en quarantaine? Est-ce qu'il va rester aux États-Unis ou est-ce qu'il va être mis en quarantaine au Canada?
Concernant la période pour laquelle on a pris la décision, je veux commencer en soulignant que c'est une situation temporaire et le Premier ministre et le Président étaient clairs entre eux que c'est une situation temporaire. Concernant pour combien de temps on va travailler comme ça, la proposition du Canada était de le faire pour 30 jours
Et après ça, de reparler, peut-être pendant notre conférence de presse, c'était confirmé. Et si c'était confirmé par le président, c'est une bonne chose. C'est très bien. Concernant les snowbirds, c'est une décision personnelle. Mais je veux assurer tous les Canadiens que les Canadiens et les résidents du Canada ont toujours le droit de retourner au Canada. Et on a donné le conseil à tous les Canadiens, commençant avec le Premier ministre, que maintenant, c'est le moment pour retourner chez soi.
To come back to Canada.
Bill, do you have anything you want to add? Et peut-être notre docteur veut ajouter quelque chose. Peut-être Dr. New, do you want to add anything?
You might want to add something.
Est-ce que tu veux ajouter?
Oui, je peux ajouter... Concernant les snowbirds, il y a deux aspects. On a déjà dit que pour les Canadiens à l'étranger, on fait un dépistage si quelqu'un veut prendre le vol. Si quelqu'un est symptomatique, on ne peut pas prendre le vol et le gouvernement a déjà les mesures pour supporter les Canadiens à l'étranger. Et si quelqu'un arrive à la frontière, c'est la frontière avec les États-Unis, on a toujours la loi sur la mise en quarantaine. Et si quelqu'un arrive avec nos officiers, on va faire un examen. Et si quelqu'un a besoin d'un suivi médical, oui, c'est sûr, on va les mettre sur notre loi sur la quarantaine pour un autre suivi, des examens médicaux suivis comme nécessaire.
And will be followed up as
Mais ils vont être mis en quarantaine au Canada.
Yes, but will that person be quarantined in Canada? Yes.
OK,
yes.
Parfait.
Okay.
Monsieur Rodriguez, maintenant, je m'adresse à vous parce que vous regardez peut-être les bulletins de nouvelles télévisés au Québec. On a vu les Québécois dire à la caméra, écoutez, moi, la COVID-19, je considère que c'est une petite grippe, c'est un petit rhume, alors je continue à aller me faire bronzer au soleil à Cuba. Qu'est-ce que vous leur dites à ces gens-là qui, en prenant cette décision-là, M. Rodriguez, mettent la vie, la santé de nombre d'individus en danger?
On leur dit d'écouter et de respecter le Conseil de santé publique. Nos dirigeants ont été très clairs là-dessus. Le gouvernement du Québec, qui, soit dit en passant, fait un excellent travail, a été très clair là-dessus. On demande aux gens de cesser tout déplacement, de ne pas voyager, certainement pas pour des raisons personnelles ou de divertissement, parce que la solution de ces crises passe par les gestes que chacun d'entre nous pose.
Merci beaucoup. Thank you everyone for coming. Merci. Oui.
As Director of Immunization, you had signed off on a master plan, preparedness plan for pandemics, you recall it well. It had estimates, with all the normal cautions, that 10 million Canadians would have to see a nurse or doctor, that between 11,000 and 58,000 Canadians would die, that workplace absenteeism would quadruple, and that there would be 2 to 3 successive waves of illness that would roll through the economy over the course of 12 to 18 months. Today, what, if any, of those elements do you disqualify as wildly implausible?
So it's a completely new virus, and its transmissibility and its severity is different. So influenza we know a little bit about. However, I think that we have been planning for a range of scenarios. I do think that there will be more than one wave. This virus is going to be with us for some time. It will not be eradicated from the world in months. This virus will continue to be circulating globally. And so what we're trying to do is delay the rapid rise of this outbreak in Canada and to flatten that curve. We want to be able to do that as long as possible, if you like. You don't want that acute rise and to hit your health system. So going into months, we will need to be prepared for another wave, potentially. Even if we flatten this wave, we need to keep going so that when the next winter comes along, hopefully we've learned an incredible amount in the next several months for us to prepare for any potential resurgence, for example. We don't know the seasonality of this virus. So that is something still remains to be seen, but you're going to have to prepare as though that this virus is going to have more than one wave. I think that's the only prudent thing to do.
Thank you. Minister Freeland,
I'm sorry, we'll have to... No, sorry, thank you. Thank you.
There's been no legal text of regulation.
We'll take the questions and get back to you. Thank you.
Minister Freeland, non-essential travel.
We need to go to speak to the opposition leaders who are a very important part of this effort, and so we need to be respectful. We'll be back tomorrow.